I'm Tina Caparelli of Heart Hand, Bodywork with an Intuitive Touch. The focus of craniosacral therapy is the central nervous system, the electrical system of the body. Among the body's many rhythms is the rhythm of the cerebral spinal fluid as it cycles between the cranium and the sacrum. And the goal of a therapy session is to release any blockages preventing the natural cycles from occurring. In a craniosacral therapy treatment, I start out by holding the heels, checking the rhythm and encouraging the rhythm to turn itself off. Once it is off, we wait for it to then turn itself back on. This tells us if there are any glitches in the cyclical flow of the cerebral spinal fluid. We then move on to the pelvic diaphragm release. We wait to feel a softening or a change in the energy. Sometimes the rhythm turns off on its own, telling us that the body is doing its work to correct any imbalance. Next is the respiratory diaphragm release, where we simply wait for any releases to occur. This is the power source of the body, so if it is weak or low, it will impact the other body systems. We then move up to the thoracic outlet. We let the body do its work, waiting for the rhythm to turn off or energy to shift before moving on. The hyoid bone, a floating bone that attaches to the back but floats in the front, is next. This is part of what's known as the avenue of expression. This area can be a problem for those who are not able to speak their truth or those who choose to suppress their feelings. Next comes the craniobase release, where the occiput meets the first vertebrae. This tends to compress and lock in, particularly for people sitting all day. The receiver will feel my fingertips slowly sinking in as the release occurs. Now we move to the frontal bone release, which provides the feeling of a gentle lifting towards the giver. Following the frontal is the parietal bones. This release is a lift out to the sides, like the wing doors of a DeLorean or Lamborghini. Next is a very important bone release, the sphenoid. The sphenoid touches all the other bones in the head, so if it is slightly off, it can influence or impact many things, such as headaches, clenching or grinding of teeth, or learning disabilities. The sphenoid bone mimics the bat-like shape of the hips. Now we move on to the temporal bone, which is a series of 3 releases. First is the temporal wobble. The second temporal bone release is the finger in the ear. This is like the old pull string toy where the toy spins at the end of a string. The final temporal bone release is the ear pull. As you can see, the pull is not straight down or out to the sides, rather it is angled like the ropes anchoring a tent. Next comes the TMJ compression, decompression. The first part encourages energy flow upward until you feel resistance. Then we wait until it is released the opposite direction, downward. The giver's hand movement is in a J motion. The next 2 releases are the traction release and the medial compression. In the traction release, the left hand is on the sacrum, encouraging the body to move one direction, and the right hand has fingers curled around the lower lumbar, encouraging the body to go the other direction. In the medial compression, the left hand remains on the sacrum and the right hand is on the anterior superior iliac spine. A very small amount of pressure is applied to allow the sacrum to drop into the giver's left hand. We then wind down the treatment with the dural tube rock and glide. The rock portion encourages the cerebral spinal fluid to go side to side. We're also feeling if more releases need to happen. In the glide, we're feeling if the body needs to do more work. The rhythm can turn off by itself and then self-correct. Just as we started, we end with the CV4 at the head. We are essentially coaxing the rhythm to stop, which it will do, then we hold until it turns itself back on. The final point of contact is the feet, checking for any changes in rhythm. I typically end with a bit of Reiki to encourage the body to continue what we just started.